Good afternoon and welcome to the Glendale Housing Authority meeting being called to order at 2:02 p.m. on September 27th. May we have roll call, please?
Council members Asatrian.
Here.
Brotman. Divine Najarian.
Here.
Mayor Kasakian.
Here, except we're going to be taking
Yes.
roll call for the Housing
Housing
Authority.
For the
Authority.
Housing Authority.
I had
But we're
both.
all here, and as well as members Ajinian and Parazian.
Sure. Housing Authority members Ajinian,
Present.
Asatrian,
Here.
Divine,
Here.
Kasakian,
Here.
Najarian,
Here.
Parazian,
Here.
Chair Brotman.
Here. Sorry for that confusion.
I think we have a joint meeting as well, and I've been there, so it's okay. Thank you.
I'll let you, Mr. Mayor, I'll let you take over from here.
This is a joint meeting,
Yeah.
so, is it not?
Yes,
Okay.
it is a joint meeting.
So with that, let's have the item before us. Well, let's have your report, please, first.
Yes, the agenda for Tuesday, September 27, 2022, joint public meeting of the City Council and Housing Authority was posted on September 22nd, 2022, on the bulletin board outside City Hall.
Great. And what is item before us?
The item is Community Services and Parks regarding funding recommendations by the Glendale Continuum of Care Board for the submission of the Glendale COC funding application to the U.S. Department of Housing and Urban Development as part of the 2022 COC Notice of Funding Opportunity Competition. A, City Council motion to approve the 2022 Continuum of Care Program priorities and authorize the submission of a grant application to the Federal Department of Housing and Urban Development, HUD, on behalf of Glendale COC under the 2022 COC program competition as recommended by the COC board, and authorize the city manager or a designee to execute all agreements, certifications, and documents necessary to accept and implement the funding. B, Housing Authority motion to approve the 2022 Continuum of Care Program priorities and authorize the submission of a grant application to the Federal Department of Housing and Urban Development on behalf of the Glendale COC under the 2022 COC program competition as recommended by the COC board, and authorize the city manager or a designee to execute all agreements, certifications, and documents necessary to accept and implement the funding.
Great. Mr. Galanian?
Yes, good afternoon, Mayor Kasakian, members City Council, Housing Chair Brotman, members of the Housing Authority. I'm going to invite Arsene Sayan, our Homeless Programs Manager, to present this report and then open it up to questions. Ms. Sayan.
Good afternoon, Mayor Kasakian, Chair Broadman, members of the Housing Authority and Council. I'm here today to provide a presentation on the 2022 COC program competition, Continuum of Care program competition. Oh. There we go, thank you. I'm going to provide an overview of the competition process and also go over the COC board's funding recommendations related to the consolidated application for the COC program. This year, HUD released this Notice of Funding Opportunity on August 1st for the COC program, making available a little over $2.7 billion to approximately 450 COCs nationwide. The goal of the Continuum of Care program is to promote a community-wide commitment and ending homelessness among various populations, and to quickly rehouse homeless veterans, individuals, families, people fleeing from domestic violence and related crimes, all while minimizing the trauma caused by the dislocation. Each year when HUD releases the NOFO, there are specific HUD policy priorities that all COCs need to abide by when they're submitting the applications. This year specifically, these are the top priorities, of course: to end homelessness, use a housing-first approach, eliminating barriers in our programs to quickly rehouse the homeless population and to prevent homelessness, reduce the unsheltered homeless count, improve our overall system performance measures across all of our programs collectively, A big one is partnerships with housing and healthcare providers, mainstream healthcare providers, to provide supportive services for our programs. And advancing racial equity, this is another big one. COCs are required to identify disparities in their communities, pull in data and other types of programming and assessment tools to identify disparities and also address those disparities in the community. Another big area is improving assistance and access for the LGBTQ plus communities. How is the COC improving access for these groups, whether it's updating our anti-discrimination policies and other methods that outreach methods we're using to reach this population. Engaging people with lived expertise in our programs. We currently have clients with lived expertise or board members with lived expertise on our COC board, on our COC committee, and our agencies also require clients to participate, or formerly homeless clients to participate in the decision-making processes for their agencies. And lastly, a big one that HUD is going to be focusing on during this competition process, but also in future competitions, is increase in affordable housing through partnerships with our Public Housing Authority and mainstream healthcare providers. How are we working with our housing authority to increase the number of permanent supportive housing programs or access to mainstream vouchers, project-based vouchers, tenant-based vouchers, and so on. Thank you. The Glendale COC has been a recipient of COC program funds since 1996, and we have secured over $60 million through this annual competition process. What we typically do is once the NOFO is released, we issue a request for proposal for all new projects. And we also issue a letter of intent. This is something new that we did this year for all of our existing agencies that are interested in applying during this competition process. Before I get into the funding recommendations, we also have a scoring criteria in Glendale. So we have scoring tools that are established by Homeless Services staff, our team, and the scoring tools are based on HUD's priorities that I previously went over. And once my team evaluates the project applications, we typically have 2 evaluators for existing projects and 3 evaluators for new projects. We then take the funding recommendations to the board, and the board ultimately reviews and approves the project applications. And this was done on September 19th this year. The other big step that we have to do, the COC as the collaborative applicant, which means the Homeless Services team submits all of the project applications, in addition to a consolidated application that we have to work on. And this consolidated application will be submitted to HUD by September 30th. In fact, the application will be made available on our website tomorrow by 5 p.m. for the public to view and to provide feedback on. The total COC potential funding amount is a little over $2.7 million. And here are the funding recommendations. So last year when we submitted this project application, we had an opportunity to rank all of our projects in Tier 1. Because HUD awarded us the full annual renewal demand, which is basically the amount that we would need to support all of our existing projects. It was a unique year, and we didn't have to tier projects. However, this year, HUD is using their traditional method of ranking and tiering. 95% of this annual renewal demand, the $2.6 million, gets tiered and ranked in Tier 1. And the remaining projects need to be ranked in Tier 2, that 5%. And projects in Tier 1 are scored and ranked based on the project type, the priority, and if these projects align with HUD's policy priorities, expenditure rates, performance measures by our agencies. In fact, this year we reviewed the expenditure rates for the last 3 years for our agencies. A lot of emphasis is going to be, a lot of scoring is going to go into the performance measures. This year, HUD is really going to score us on this area. Therefore, our scoring tool took into account the HUD priority. We decided to rank our, as you can see, number 8 is the Consolidated Shelter Plus Care Project. We were strategic in the way we ranked these projects this year. We have been administering the Shelter Plus Care project since 1996, and this is done with the collaboration with Essentia. So the City of Glendale administers the rental assistance program. However, we have an MOU with Essentia, our lead homeless services provider, our CES provider in Glendale, to provide case management. But the last 7 years, we've been struggling to spend down on this project, and we've been returning a substantial amount of funds, around $100,000, because we're unable to meet the match requirement for this program. Each of the COC projects require a 25% match commitment. It could be in kind or cash, and specifically for this program, we have to leverage funds from supportive services and other types of eligible services that are offered to our clients. So we did rank the project in Tier 2, 133,067, a little over 133. However, it was done strategically because what we're hoping happens is we get awarded the 133. HUD is likely to fund all of the projects in Tier 1, but projects in Tier 2 are funded based on how well we do on our COC consolidated application, and as well as how much funding there is to go around for Tier 2 projects. But what we did this year is we were able to secure commitment letters through LA County's Department of Public Health, and also through the state, the Homeless Housing and Incentive Program, HIP funds. We've been able to secure partnership with 2 managed care plans, LA Care and HealthNet. The proposal was accepted, however, it hasn't been finalized yet. The managed care plans have to submit an investment plan by the end of this month, but we'll be working with them to develop this agreement, and if that does go through, we'll be able to secure the 25% match that is required for the Shelter Plus Care program, which means we'll be able to serve more clients next year and also be able to successfully move clients on to the EHV program with the supportive services tied to it, to create flow in our existing permanent supportive housing programs. We also have a COC planning project. We have been a recipient of the planning project dollars for 7 years now, but it is considered a new project each year, therefore it's not ranked. And that's around a little over 79,000. Here's just a quick overview of our scoring criteria. We have threshold requirements that our agencies have to meet. Audit, financial audits are reviewed. They have to be active registrants for SAMs. There's specific threshold requirements, HMIS data quality. Bed utilization is also taken into account if all of our agencies are at full capacity and utilizing the beds. System performance measures, how are they promoting access for clients in the coordinated entry system? How are our agencies updating their screening and assessment tools to promote equity and to reach the most hard-to-serve populations? And of course, the overall CES policies and procedures. This is something that we'll be working on this year as well. We have to work on an anti-discrimination policy for the COC, as well as a disaster preparedness plan. As a result of COVID-19, this is something that HUD will be evaluating as part of the COC program requirements. And lastly, just grant utilization and financial efficiency. How will our agencies able to spend down year after year? And if they're able to utilize the funds to support our clients. All right. And that concludes my presentation. I'm happy to answer any questions you might have.
I'm going to pass the gavel to Mayor Pro Tem Najarian, and I'll be back briefly.
I'll be kinder to the gavel than it was treated last week. Thank you for the presentation. Are there any questions?
I have a couple of questions. So we are going to, even though that Shelter Plus Care project is Tier 2, we are going to try to access funding for that project, so it continues.
Yes, Councilmember Devine, Chair, Housing Authority Member Devine,
okay,
sorry. Yes, we are. That is the goal. So we're hopeful that we get awarded the $133,000, and if that happens, great. We'll be able to serve more high acuity clients in the program, and it's a win-win because we'll have the mainstream healthcare support tied to that project. So we'll be able to meet the match requirement.
Okay, and we are not applying for new projects because we're trying to work on the partnerships. Was that the HealthNet and the
LA Care? LA Care and HealthNet, they're managed care plans. And as part of the state's funding, the Homeless Housing and Incentive Program, HIP funds, the managed care plans are now working directly with the COCs to secure partnerships so that they can offer the mainstream support. Because a lot of the funding went away for supportive services years ago in the COC program. So HUD encourages the COCs to really pull in partners from, managed care plans, other mainstream healthcare providers to leverage funding for the supportive services dollars to make sure we have capacity for case management, housing retention, housing navigation services. And that's exactly what we're doing this year, and we're really excited about this partnership.
Great.
Yeah.
And my last question, recently there was an article in the LA Times about Los Angeles giving back millions and millions of dollars to HUD because they said they couldn't use it. Can you explain, how does that impact us? Are we impacted by that at all? Or could we be, is there any recourse for us to maybe get more of that funding so that we can use it for some of our programs?
Chair Broadman, members of the Housing Authority. That is true. I know with our CARES Act funding, we received a little over $3.5 million in CARES Act funding. It has been challenging to spend down the CARES Act funds. There are a lot of restrictions that are tied to the ESG program, and ESG CV2 program is what they call it. But the City of Glendale thankfully met our 50% expenditure requirement in June. I know that some other COCs, I'm not sure if this is specific to LA, but I know that some other COCs unfortunately did not meet that expenditure threshold back in June. So HUD did recapture a significant amount of funding just across the COCs. However, Glendale did meet its 50% requirement, thankfully. So now the goal would be to reprioritize and reprogram funds to where we see that we need the most. And we're going to be doing that through our community meetings, stakeholder meetings, that we'll be launching on October 19th. We're in the process of finalizing our flyer. We want to translate it in Armenian and Spanish just to make sure everyone can attend this meeting. Okay. We're going to be launching a series of stakeholder meetings in person and virtually so that we can submit a substantial amendment and reprogram the funds. And that is why we didn't apply for any new projects, because we first want to focus on strengthening our coordinated entry system, pulling in the right partners, countywide, state, leveraging those resources and making sure that we actually have capacity to apply for new projects. And the goal right now would be to reprogram the CARES Act funds.
And where exactly would you relocate this funding? What kind of projects or?
Based on our last stakeholder feedback, there's a great need for interim housing programs, hotel, motel vouchers, 90-day shelter type, non-congregate type programs. We also see a great need in rapid rehousing programs for homeless families. There's a lot of great need for our families here in Glendale. And also homeless prevention and outreach, expanding our outreach team. So those are just a few, but we'll be able to narrow down that list once we get more feedback from our community and our service providers through these meetings.
Thank you. And I just want to say that you do a fabulous job. Thank you for the presentation. It was spot on, and I know in the background of things you are doing a stellar job. Thank you.
Thank you so much. I appreciate the support.
Concludes my questions.
And everybody, to be honest, that's one thing we hear from everyone is how does Glendale keep a handle on the homeless situation? And obviously, the council would like to take some credit, but the majority goes to you and your department, and Peter and everyone else in that group. So.
Takes a village, so thank you so much. I appreciate the support.
Sure.
Because we have a homeless crisis that's just growing in Los Angeles, and I know that Ascensia is expanding into Los Angeles further, is that impacting our programming and our partnership with them in any way? Do you need additional capacity? city?
Housing Authority Member Asaturian, Council Member Asaturian. We are working with Essentia, and we have been actually for the past year. We know that they have been expanding. They are working with other service planning areas, spa areas, providing outreach, West Hollywood, East Hollywood. But we have been trying to establish a stronger partnership here as part of the coordinated entry system. We have been listening to their needs. We have been trying to connect again with the county to provide that additional support for them so they don't feel, they can continue providing the services at the level that they should be here in Glendale. That is something that we are working on with Essentia to see how we can come in and provide that additional support to make sure that our clients are being prioritized and served in the community in our programs.
And I mean, I definitely want to join in my colleagues in thanking you. I've seen firsthand your fast response rate from helping women who are escaping domestic violence, who've just randomly reached out, trying to get assistance to people that are about to become homeless. And at the speed in which you guys respond and the thoroughness of your work is unprecedented. And it can be months later, I still get like messages from them saying how you guys really just turned their lives around. So thank you for all the work that you're doing.
Thank you so much. Thank you.
And Onik, too. I left Onik out of that round of congratulations. Chair Brown.
Yeah, and ditto from me. We did get some criticism recently about our increase of 33% from the homeless count versus we're hearing low numbers for LA, and then I read an article that the LA numbers are really suspect, so who knows? But anyway, I was just hoping that you could address that, and I think there were some ways in which we did our count that are different from how LA did it, and there were some other, I think, very reasoned explanations. So I don't know if Mr. Volanikian wants to address that, or you do.
Chair Broadbent, members of the Council Housing Authority, I'd be happy to address that. When we present the homeless count report, we always state that it's just a one-day count. It's a snapshot of what our community is facing in terms of homelessness. The homeless count numbers do not in any way tell the full story. There's absolutely no way you could possibly reach every single person, every single family. There are a lot of people that are invisible homeless. They're couch surfing, they're doubled up. Depending on the day or the hour or what the weather is like, you're definitely not going to reach everyone in your community. But it's just a snapshot to give you an idea, to kind of identify some of the trends, the needs, the population, the subpopulations. But this year what we did, and every year we try to make improvements to the count, and one of the reasons that I think contributed to the increase was we extended the hours of the count. A lot of our site providers, the service providers and community centers, instead of counting, let's say 3 hours to 4 hours during the day, they actually had volunteers staffed at each location, counting everyone that was walking in and was potentially homeless or at the risk. That was one thing that we did. And we reached out to more providers this year. We worked with our local hospitals, Memorial Hospital, Dignity Health. They were so supportive in this count and even worked with us the day after to get us numbers. So Glendale Community College, we worked with Mr. Manukian and his team to make sure that we were identifying everyone that was coming through for services at GCC. So these are just a few examples that I could put out there. I think there was definitely a longer period in which we counted, more support from the volunteers and the service providers. And also, there is one other area that we focused on this year, Glendale Police Department's data. Our Glendale Police Department does homeless outreach, and they now have access to our HMIS system, our Homeless Management Information System. So they're able to do intakes on site and track data. This data has been so helpful to us because we're actually able to track homelessness in our community for the entire 12 months that they're providing outreach versus one day. So HUD allows agencies to use a comparable database for people who don't complete surveys to extrapolate that data and come up with it's very complicated. I'll try to count everyone who does not complete a full survey. In the past, we weren't able to do that. If clients don't complete a full survey, you unfortunately cannot count them as part of the count. So that was another area that we focused on this year, to pull in as much support and information as possible. So, you know, there are a lot of reasons. Of course, you know, COVID and other, you know, factors go into it, but the ones that I could think of were just, those were the top three for our COC.
And would you say, without going into a whole lot of detail, would you say LA made all these same modifications to how they do their count? Do you have any idea?
LA doesn't do survey-based counts, they do observational counts. So, you know, volunteers will typically walk around or drive around. If they see an encampment, you know, there's a specific formula they use, like, you know, this encampment has 6 people. That's what you're supposed to, you know, tally up 6 people. There's specific formulas. We don't do that. We actually approach the individuals or the families and we complete a survey. So our numbers are based on the number of surveys that are completed. So we come face to face with the homeless population. So that could be also another reason.
Okay. So it sounds like it's, maybe the numbers are up because we're getting a more accurate count of the problem that we've faced for a long time. And I think that's a positive thing that shows that we're doing our job better. So thank you for that. And,
You're welcome.
and for everything you do. And yes, your explanations are always very clear and easy to understand.
Thank you.
Authority Member Hajinian.
Thank you for your presentation. It was wonderful. My question is kind of, could be far-fetched, but as you do, you mentioned you go to make a surveys, you know, when you go question them. I wonder if you ever wondered, have any of these homeless or former residents of the city have casted a vote during elections? This should be an interesting number there.
Authority Member Ajinian, that's a great question. We haven't done that before, but we do always modify our surveys to add additional questions. So if that's something that you guys would like to see as part of our survey, we're happy to add that on our.
Because they do in
survey
LA,
count.
and they even have homeless leaders who participate in elections. One president for mayor. So.
We have homeless clients and formerly homeless clients who participate as part of our count. So they actually go out with us to conduct the count, which is always nice to have them. They know sometimes different places. And so, but if there's specific questions that you would like for us to include as part of our survey to capture more data, we're happy to do that.
Thank you.
Thank you.
Authority Member Parazian.
First of all, thank you for your report and the job you're doing for the community and your staff. I have a quick question. In the report, it says there are 450 continuum of care programs. Is this all over the country, I believe? Yeah.
Yes, Authority Member Parazian. It's nationwide, approximately 450.
So
that
that
number can grow.
That means not every city or community are getting the programs.
No, COCs.
Okay. Thank you.
Thank you. We do have one caller. Why don't we hear from the public on that?
Yes, we have one caller, Karen Kwok. Karen, you're on air. You have 3 minutes. Karen? Karen Kwok, are you on air with us? Hello? Okay, for some reason we're not able to hear her.
Okay. Well, I will say we got a letter from Karen.
Hello? Sorry.
I think Mr. Brotman raised some of the issues that she raised regarding the counting methodology. I'm not saying that's what she was going to talk about, but just to fill some time in case she's going to get on the phone in a moment or so.
Sorry, we're having technical
We
difficulties.
move on,
I
or
don't know.
should we wait for her? Does it appear that she's still on the line?
She's on, but you.
Okay. Well, I apologize for the difficulty. That's on us, Karen. And,
I'm going to try one more time.
okay, sure.
Karen, can you hear us? Hello?
Sorry.
All right, sorry, Karen. So if there's no further discussion, there is a council item and a housing authority item. Would someone like to move the item for the council?
I'll move the item. I'll move
Second.
the item.
Roll call, please. For council?
Do I take roll call twice? One for
We'll
council,
do them
okay.
separately, I think.
Separately, okay.
Yes.
I will begin with council roll call. Council members Asatrian,
Yes?
Brotman,
Yes.
Divine,
Yes.
Najarian,
Yes.
Yes.
Mayor Kasakian.
Wait, you don't get to
don't
vote on
vote.
that.
That was the majority.
Now I'll move the housing item.
I'll second.
Okay, roll call, please.
Housing authority members Ajinian,
Yes.
Asatrian,
Yes.
Divine,
Yes.
Kasakian, Najarian,
Yes.
Parazian,
Yes.
Chair Bartman.
Yes.
Would you like to register a yes vote on both of those items?
Yes.
So please register the mayor's votes. We're at the end.
Should we,
Move to adjourn
Yeah.
for council.
okay,
Second,
and
move to adjourn for housing.
Second.
we are adjourned.
Thank you.